Hi there everybody and welcome back to my channel. Today I will be talking about pigment dispersion syndrome and pigmentary glaucoma, which are secondary types of glaucoma. So if you want to learn more about these, then please stay tuned. Classic findings include pigmentation of the trabecular meshwork, mid-peripheral iris transillumination defects, and pigment that is deposited on the endothelium of the cornea. The problem with this pigment deposition, particularly in the trabecular meshwork, is it can result in transient elevations in intraocular pressure, and ultimately this may result in optic nerve head damage and therefore pigmentary glaucoma. The reason pigment is liberated is because the iris rubs against the zonules and therefore pigment is released. Pigment dispersion syndrome becomes pigmentary glaucoma when optic nerve head damage occurs. These conditions are commonly seen in males. The age group is characteristically 20 to 40 years of age, and it is more commonly found in Caucasian patients. In terms of additional risk factors, patients who are short-sighted more commonly have pigment dispersion syndrome and pigmentary glaucoma. Patients with flat corneas and also a family history are more likely to have these conditions. Patients with these conditions should be asked about trauma, previous surgery and other eye conditions, as these three can also liberate pigment, and therefore a careful history and examination are crucial because this is largely a clinical diagnosis. In advanced presentations of the disease, patients may have visual field loss. However, characteristically and typically in young males who are working out, they will report blurred vision and halos around lights, and also this is exacerbated by dim lighting conditions. Clinically, Krukenberg spindle should be checked for, the cornea should be evaluated, the intraocular pressure should be checked, and transillumination defects should also be looked at carefully. To assess the drainage angle and the level of pigment within it, gonioscopy is a must. Once a diagnosis of pigment dispersion syndrome or pigmentary glaucoma is made, then the appropriate steps can be actioned to manage the patient. In terms of pigmentary glaucoma, the management steps center around lowering the intraocular pressure. Different treatment options include drops, laser treatments, and surgical options. The appropriate option for each patient will be chosen based on their individual characteristics and the extent and nature of their disease. Also, patients will require very close follow-up to understand what is happening to their intraocular pressure, as different treatment modalities are actioned for them. If you have liked this video about pigment dispersion syndrome and pigmentary glaucoma, please subscribe to the channel, give it a thumbs up, like and comment. Until next time, thank you.